Hello everyone. Today we'll be talking regarding brain death. Traditionally, death is thought of as cessation of breathing and the heartbeat. What is brain death? It is the irreversible loss of capacity for consciousness combined with irreversible loss of capacity to breathe. Two things you can keep in mind: capacity for consciousness and capacity to breathe. These two are lost in brain death. We all know these capacity for consciousness and capacity to breathe. These are essentially the functions of brain stem. So, brain death we can also call as brain stem death. And now, with the advent of mechanical ventilation, it became possible for us to support such a dead patient temporarily. Before deciding on a diagnosis of brain stem death, it is essential for certain preconditions and exclusions to be fulfilled. In this section, in this topic like brain death, the question that we'll get in the university examination is diagnosis of a brain death or diagnosis of a brain stem death or diagnosis of a brain dead patient. So these are the questions that we can get from this topic. So I'll be talking regarding how to write or how to approach that question, and mostly this would be a 2-marker question. For before diagnosing a brain death patient, so there are some preconditions, and let's see what are those preconditions. The patient must be in apneic coma. That means the patient should be unresponsive and he or she should be on a ventilation with no spontaneous respiratory efforts. So these conditions, they are called, the patient must be in apneic coma. So this is one of the preconditions for diagnosis of brain death. And irremediable structural brain damage should be there. That means any disorder that causes the brain stem death that must have been diagnosed with certainty. For example, any head injury, any intracranial hemorrhage, these things. Like any irremediable structural brain damage, the damage of the brain that we can't cure, like we can't repair, those kind of damage should be there. So these are the two important preconditions. Like the patient must be in apneic coma. Apneic coma means he should be unresponsive, he should be on ventilation, and there is no spontaneous respiratory efforts. And irremediable structural brain damage should be there, and with certainty, like any head injury, intracranial hemorrhage, etc. So now let's see what are the exclusions. The possibility that unresponsive apnea is the result of poisoning, sedative drugs, or neuromuscular blocking agents must be excluded. Like the patient is unresponsive, that we have told before, that should not be because of any poisoning or any sedative drugs. So in poisoning and in sedative drugs also the patient can be unresponsive. So it should not be like that. That is one of the first exclusion criteria. The second one is hypothermia must be excluded as a cause of coma. The patient is in coma, but the coma should not be due to hypothermia. That we have to rule out. And there must be no significant circulatory, metabolic, or endocrine disturbance that could produce or contribute to coma or cause it to persist. For example, any acid-base imbalance, electrolyte imbalance, or glucose abnormalities. Hypoglycemia stage also will look like a coma condition. So these are the 3 important exclusions that we have to look on before diagnosis a patient as brain dead. So now let's see what are the diagnostic tests to tell the patient is brain dead. All brainstem reflexes will be absent, because we have already told it is also called brainstem death. So all the brainstem reflexes will be absent. Coming to the pupils are fixed and they are unresponsive to bright light, and the light reflexes are absent, both the direct and indirect. The size of the pupil is irrelevant actually, but mostly it will be dilated only. Coming to the corneal reflexes, they are also absent, and there will not be any vestibulo-ocular reflex on caloric testing. How to do caloric testing and all we have studied in ENT. So coming to the motor responses, there will not be any motor responses within the cranial nerve territory to any painful stimuli. There won't be any gag or cough reflexes in response to pharyngeal, laryngeal, or tracheal stimulation. And as we all know, the patient is unresponsive and there won't be any spontaneous respiration. And the patient is ventilated with 100% oxygen for 10 minutes. And then we will be temporarily removing the oxygen support for 5 minutes. And then the oxygen is maintained by insufflation with 100% oxygen via endotracheal tube. And the patient should be observed for any signs of spontaneous respiration. So this is the way that we are observing. We should observe the patient for any spontaneous respiratory efforts the patient is showing or not. And also during this procedure we can check the arterial blood gas also, and how the partial pressure of carbon dioxide and all we have to check. So once again I will repeat, this is a short topic and it will be asked as 2 marker only. How to diagnose a patient brain dead? There should be some preconditions are there. The patient must be in apneic coma, that is the patient should be unresponsive and on ventilation, and there is no spontaneous respiratory efforts, and there should be structural brain damage, and that is diagnosed with certainty. For example, any head injury or any intracranial hemorrhage. Some exclusions are there. This unresponsive apnea should not be due to any poisoning or sedative drugs or neuromuscular blocking agents, and hypothermia should be excluded, and it should not be a cause of coma, and there should not be any significant circulatory, metabolic or endocrine disturbances like any acid base abnormalities, electrolyte imbalances, glucose abnormalities, etc. Diagnosis test, all brain stem reflexes will be absent, pupils are fixed and unresponsive to bright light, the light reflexes are absent, the size of the pupil is irrelevant, but mostly it will be dilated. And coming to the corneal reflexes, they are absent. There is no vestibulo-ocular reflex on caloric testing, no motor response within the cranial nerve territory to the painful stimuli. There is no gag or cuff reflexes in response to pharyngeal, laryngeal or tracheal stimulation. Spontaneous respiration is absent. And how to check that? The patient is ventilated with 100% oxygen for 10 minutes. Then we will be removing the support for 5 minutes. Then oxygenation is maintained by insufflation with 100% oxygen via the endotracheal tube, and the patient is observed for any signs of spontaneous respiration. And if there is no signs, and if all these criteria are fulfilled, then we will call that patient as brain dead. So whenever a question is asked like how to diagnose a patient brain dead, you have to write all these points, and this will be sufficient for writing a 2 marker. So thank you all and have a nice day.